Good morning, this is Clinton Miner from Sawtooth Bushcraft. Just give you some statistics, and what I want to look at first is the Johns Hopkins map. You see here the numbers actually at Johns Hopkins are quite a ways behind the worldometer, but as I looked at the worldometer just a few minutes ago, it was showing 134 confirmed cases in the world. You see that Johns Hopkins is showing only 169,000. The other thing that's going on with the worldometer is that in looking at that earlier, that 174,000 number had yet to include any updates from either Italy or France, both of whom are growing very rapidly. Yesterday, Italy added over 3,000 new cases and France added over 1,000 new cases. If the curve continues as expected, Italy will add more than 3,000 new cases today, and France will probably be closer to 2,000 as opposed to the 1,000 and some that it had yesterday. In my estimation, I think by the time that both of those add their numbers, we're going to be seeing someplace closer to 180,000 individuals that have been infected in the world, and we'll talk about the specifics of some of those countries in just a minute, but let's go on. I just want to share the idea of what happens with social distancing. The first thing I want to point out is an excellent article. I will put the link to this article in my description, but it is an article out of the Washington Post, not always one of my favorite locations to get news, but this one is spot on as far as everything that I've read from the physicians, from the hospitals, from the CDC, about what happens when we take some steps with social distancing. And you'll see in this article there are some interactive or actually illustrated simulations. This first simulation shows what happens without any limitations or social distancing and how fast a population can spread something like the the coronavirus. We go on then to the second illustration, and it shows what happens when you try and shut off cities. That's fine for a short period of time, but eventually something's going to get out, and you have very much the same kind of a situation, just in a delayed way. Delayed is good, but this is not the best way to delay, and it gets into the general population and grows very quickly. We go on to the next one, and that is if 3/4 of the population self-isolates. In other words, not because there's been a quarantine put around their city, but because they choose to stay home, and only 1/4 is out there. One of the things you see are there are two things. It goes much slower, but by the time the spread goes through the whole population, much of the population is already through the condition, done with it, and it has the immuno antibodies that are going to help it. So that's a really good thing if we can keep all but 1/4 of the people in. The last one is if we keep all but 1 out of 8 people in. That would slow it drastically. You see again what's happening is the number of sick is growing very slowly, but it is being followed very rapidly by the number of individuals who are recovering, and we then spread that out. We flatten the curve, and above each of these you'll see there is a curve. This is the curve we don't want. This is a curve that happens too quickly, and frankly that curve is a lot flatter than it really should be. There's going to be some isolation, in other words, blocking off countries or cities. We get this kind of a curve. With 1/4 of the population staying at home, we get a curve that's much, much better, or all but 1/4 of the population staying at home. And if 7 out of 8 people stay home, and only 1 out of 8 goes out into the city, shopping and those kinds of things, then our curve becomes much flatter, and we end up with a much, much better situation, particularly as far as the healthcare professionals. So as I look at this next set of charts, it helps us illustrate really what the differences are in what happens when we social distance. South Korea acted very quickly. They did a couple of things. They isolated some cities. We saw in those charts that does some good, but not that much good. But then they also had mandatory isolations on the individuals who had contact with that person 0 and with whom they had contact. And then they did something that we need to do here, and they asked the population After canceling all sporting events and social events and closing theaters and those types of things, after they did all of those things, they asked the people of South Korea to self-isolate. And because the people were compliant with that, the numbers in South Korea go in a bell curve. We are already seeing a decline in South Korea, where it actually should have gone, almost could have surpassed some of the numbers out of China. But they took the steps necessary to slow this down and to spread it out so that people had the resources. In Italy, on the other hand, they waited until they had a crisis before they started closing things down. They saw lots of cases, and they, even when they started closing things down, they closed them down piecemeal. They closed down some soccer/football matches. They closed down a few things, and by the time they said, okay, everybody needs to stay home and everybody needs to stay in their apartments and everybody needs to do all of those things, we already had an explosion. As we look at these two charts, you can see the difference, that South Korea had a cap and is coming back down, and that Italy continues to go up. These dates, February 15th to March 15th, are the same, February 15th to March 15th. And you can see that South Korea was already growing much quicker than it was in Italy, but because they put that cap on things early, it started going back down. Now, you'll see the same kind of a bell with Italy, but that bell is weeks behind what is happening in South Korea, even though they are very similar circumstances. Actually, South Korea should have been much worse. The other thing you need to look at is you look at these two charts, and you may not be able to see them on your screen, so I'm going to tell you. Along this axis here, the upper axis, these numbers are from 0 to 1,000. So over 851 was the most cases per day that South Korea ever experienced, and they are down to 76 cases per day at this point. That is a bell curve. This chart over here with Italy is from 0 to 4,000. So it is actually 4 times as large as the one in the South Korea measure. And so the most cases they've had per day were yesterday, 3,500 cases. That's half the number, nearly half the number that they have total in South Korea. Social distancing, spread of this goes way down. And what that means is in South Korea, this is the real telling number, in South Korea, they've had 8,236 cases. In Italy, they've had 24,747, as I said. More telling still, much more telling still, is the impact it's had on the healthcare systems. South Korea, because they didn't have an onslaught, because they were able to deal with the people who were severely and critically ill, has had 75 deaths as a result of this. Italy, on the other hand, is completely overwhelmed. They have had 1,809 deaths, and again, that does not include today's death rate. So self-quarantining helps drastically. Kids are going to be out of school here in Idaho. If your kids are out of school, that doesn't mean it's a play day with other people. It doesn't mean you go to the movies. It doesn't mean you go to jump houses or those kinds of places where you're going to have those children interact. Now, those kids aren't going to get terribly sick, but they're going to bring it home. And you may not get terribly sick, but remember the people you will kill if you don't slow this down. Limit this in such a way that I don't know that we're ever going to keep all of us from getting it, but if we can spread it out, we can not overrun the hospitals, and we can keep those death rates low like they've done in South Korea. And as we say here at Sage to Sawtooth Bushcraft, if you're prepared, you're never really lost. Thank you.